because we did get some feedback from folks on our fact that we have to make a recommendation today as to what we want myself and May to take forward to executive team in terms of our handling of the 2021 wellness reward. So we may have a few people watching online. As I told people in email, our meeting is not open for public comment, but the way that our friends and colleagues should get their voices heard is through us. So to the extent that you talk to folks, please share with their concerns, in this meeting. You'll see that we will have a chance to talk about those recommendations. So in the interest of respecting everyone's time, I'd like to go ahead and get started. This is our May meeting. It's our third meeting of the year. We will be finishing hopefully before 3:30. I did email out the agenda to everyone this afternoon. It's been posted on the website for the 7 days as required by statute. But again, for those who might be watching this, we are going to review our minutes from last time. We are going to discuss how we want to make a recommendation. We will turn it over to Charmaine and Denise to give us an update on where the Florida College risk system is for the proposals. Again, they sent out, I think, 4 bids and at least got bids back from 3. And then it'll be kind of a group effort in terms of talking about what we heard at the budget workshop on Monday. For those who were there, I know Judy was there. I was able to listen. Imagine a few more of you watched as well. So we can kind of discuss what we heard and what we are waiting for. And then we have open discussion time as well. And I have one item that I want to bring up there regarding procedure changes that Paul emailed out to the college today. So, all right, with that, shall we move into reviewing of the minutes? If you have any amendments that you want to make, we'll do it page 1, page 2, and then page 3, page 4, and then page 5. And then we will, if we need to vote on the amendment, the only time we vote on the amendment is when there is a substantial change. If there's a typo or a point for clarification, we wouldn't necessarily have to vote on that. So friendly amendments, we don't have to vote on. Anything that changes the substance, we should vote on the amendment, and then we'll turn around and vote on the whole set of minutes. So I'll give you a moment. Are there any amendments needed for pages 1 or 2?
I'm not a voting member, Tracy, but these look really good. Thank you, Donna, for taking such detailed minutes. Awesome job.
Yes, indeed.
Thank you.
Okay, I'm going to go ahead and advance to the next slide unless I hear otherwise from people. I just have, it's a friendly amendment. The numbers through March 31st. Never mind, it's my eyes. No friendly amendment. I don't know if I should be worried that I saw 2 1s in that number.
I do have a question about the 1, 2, 3, 4th bullet under numbers through March 31st. 412 earned a reward. I
Okay.
don't recall that number. I think that should be 354.
I don't have my notes. There are notes from the
Denise,
budget.
I think 412 was the number for this current year. For the year that we're in?
The one that's ending July 31st?
Uh-huh.
No.
No,
The
no,
one
the
that
one that's ending
ended.
December. Yeah, the one that we already did.
Oh,
But we're
okay.
getting the-
Thank you. I'm confusing my years. Thank you.
Okay. Mhm.
Well, could I offer a suggestion then just for amendment, since even I didn't know what that was? Can it say 2020 wellness program?
Yes, I would consider that to be a friendly amendment.
Thank you.
So I don't think we have to take a vote on that because that's just a point of clarification.
All right, I'll make that change.
And
Thank
then,
you.
and just a question, the three numbers above that, that's related to the year that we're in for 2021, correct?
Yes, the
Yes.
9151 212 is for 2021 wellness, but the 412 is for 2020 wellness.
Yeah, so we may just need to clarify current versus future or something to that effect.
I'll add the 2021 to the first three bullets.
I think, Donna, I highlighted it in red. I think that if you just put March 31st, numbers through March 31st for 2021 reward,
Okay.
and then maybe switch this bullet point here in red with the one below it, and then take this bullet point and move it out and make its own, so that way there's a point of reference for the 2020 reward.
Okay.
That's perfect, Tracy.
Okay. Anything else on pages 3 and 4? Okay.
Actually, I do have one thing down below the very last bullet where it says there will be a mandatory open enrollment. I think that should be there may be, as opposed to will be on the page, the left page. The left
Page,
side.
last bullet, page
Last
3.
bullet down.
Mhm.
Mm-hmm.
Yeah, so we should amend that to. Okay, thanks, Liv.
Yeah, that we discussed that we may have to have one,
Okay.
not a will be.
Okay.
Again, I highlighted it in red and then circled it in blue just to reflect the maybe. And again, I'm just gonna ask to make sure there's no objections to that. I mean, that was our conversation last time. It's a maybe if there's a vendor change. So seeing no objections, Donna will change the record to reflect maybe. Anything on the 4th page before I go on to the 5th?
None from me, Tracy.
All right, then I'm going to go ahead and advance to the next slide, which is page 5, which is a short page.
Looks good.
Okay. Then can I get a motion to approve the minutes?
Motion to approve?
Pamela is our first. Can I get a second? Second is Denise. Do I have consensus? Just a
Yes.
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 okay. Any objections?
No.
Then the minutes are approved. Thank you. All right, this is the same slide that I had up at our last meeting. It's just a reminder that the wellness program for 2021 changed, and so we only have 2 requirements as it currently stands. We have to complete our wellness appointment. Prior to the pandemic, this would have been a face-to-face visit to the doctor, and then we would also complete that biometric screening, which either could have been ordered by your doctor, and then the doctor fills out the results and sends it into Quest. You would have to print out that form for your doctor to fill out, or you could have scheduled your wellness appointment at Quest directly, and they would have just done the basic biometric screening. So again, that was all prior to the pandemic. As a reminder, or for people who might be watching the live stream, we are discussing what's the best way to move forward in handling the ways in which we earn the reward. And so what I have up here is by no means a comprehensive discussion. It's just sort of buckets that, as I got feedback both from faculty as well as from the committee members, I kind of did a quick summation or kind of bucket title, if you will. So what I have going on here is, let me see if I can use my spotlight. Here we had, I don't want to do that spotlight because you guys, I'm basically just drawing over my graphics here. So basically what we have is we could keep the program as is and do nothing. I can tell you that I don't know that folks would find that to be that desirable, but that's definitely an option that we could discuss. There was another bucket that sort of said, well, instead of having people go for the regular doctor's appointment where you physically have to go into a location, could we modify our program that virtual health screenings would be permissible and would be accepted as the equivalent of having a screening. I apologize for the typo. It should be biometric, not biometer. But another option would be waive the biometric requirement. And those two could run tandem where you encourage folks to at least have a conversation about your ongoing health with your doctor, even if you don't see them physically in the same space. And then by waiving the biometric screening, what we would be doing is recognizing the fact that the Quest centers are at kind of a reduced capacity for the wellness screening. Another option that came through on feedback is, out of those numbers that were present in the minutes, we've had 91 people complete both. We've had 51 people complete the screening, but not the exam. And we've had 212 people complete the exam, but not the biometric screening. So, you would basically use those numbers, and regardless of doing 1, 2, or both, you would give them credit. Another option that has been discussed, and the HR folks would work with Florida Blue to see what the parameters would look like, is to basically offer an alternative set of workshops. We've heard numbers like 5 workshops, 3 workshops, 1 workshop, but basically without going back to the Cafe Well program, because those videos got retired, we would be working with our vendor, Florida Blue in this case, to have, whether they be Zoom live workshops that you would enroll in, like Lunch and Learn, whether they would be what we call asynchronous learning opportunities, where if I want to do the workshop at 1 a.m, I can do that. If Denise wants to do it at 8 a.m, she could do that. So that's another option. Another option, which I received from faculty, but I imagine some of you also got the similar advice, is that let's just give everyone the 2021 wellness reward. So yes, for those 3 buckets of people who have done one or the other or both, but then for those who have done nothing, we don't know for a fact that they wouldn't have done nothing, because in the case of faculty, a lot of folks wait until the summer to go and do their appointments. Once you finish your full-time schedule, some folks go down to just 2 courses or no courses for term A or term B. And so that came, I know, from the faculty side. I don't know if other employee groups got similar information. And then just for good measure, and I'm going to underline this with the gray, there could be other options, right? I mean, I didn't get emails back from every single committee member, which is fine. You were not required to email me back. But I want to just remind folks that the buckets that I've gotten an email are not necessarily our only options. So we have time now to discuss how would we like to move forward. So I've got 2 hands up. I've got a hand from Judy and a hand from Susan. And to be honest, ladies, I didn't see whose hand went up first. So
I can help you. Susan's was up first.
Thank you, Denise. So Susan, I will turn the floor over to you.
Actually, I had a question, and I still do, but then I had another question with the discussion after my first one. One is, last year you had to make certain numbers on your blood test. Is that gone for this year, so that you just have to do the blood test?
Okay, so the idea of making certain numbers, making certain numbers wasn't connected to whether or not you'd be eligible for the wellness reward.
No, you had to
making
get
certain
points.
Numbers was to get the points, and you could do the reasonable alternatives. So for example, if my cholesterol was high, I would have to do a learning opportunity. So that is waived this time. Now it's just really a discussion between you and your doctor.
Okay, so it's just doing it, and it's not getting
right.
Accurate. Then the other question I had was, since we are just recommending to the board, and they didn't want us to do something, to say let's just waive it for this year seems like a sort of a pointless. I mean, it seems sort of. I think it would be harder to go back to doing something. You know, maybe saying just do one would work, but to completely waive both, I don't know if the board would agree. And I'm not even sure that if the point is to moving forward, you know, I think that would become difficult then for the following year to say, you know, now you have to go back and do it, because I think people will be like, well, we didn't have to last year, so why do we have to this year? And then aren't we back to where we don't do anything again?
I think that it's a really good point, and I will say that there was a faculty member in nursing who was disappointed to see that the wellness program was not quite as robust as the first offering of it. And so I think that there's definitely a group of people that share those same sentiments, Susan. I just, in terms of, you know, my representation as well as yours of faculty, I'm just sharing kind of that wide spectrum of.
No, I understand. I was just giving my question about that.
And I do want to use this. I do want to use this as an opportunity, because at our last Zoom meeting, I felt like, you know, we did what we needed to do in terms of discussion, and we didn't have a lot of motions to vote on. And this time it's a little bit different, because this is a really big and really important recommendation. And so I want to make sure that the technology doesn't inhibit us from having that full discussion. So let me call on Judy, and let's continue on the discussion.
Okay, so I'm going to apologize up front. I've just been slammed with emails. I'm sure we all are. And I was not able to put my list together for you, but we did have some great feedback. Pamela and I did a survey of administrative, and so some ideas that were popped up out of that. One of them was to hold labs on campus to do the blood work. So, you know, we're doing drive-through testing. Can we do something like drive-through blood work or drive-through or even, by appointment blood work, but just do it on our campus. Is that an option? And another suggestion, which I don't know if it would really work, but I'm going to put it out there anyway, is extend the date to September 30th and accept the flu shot in exchange for the blood work. And then similar to what you had already brought up, we talked about the possibility of training, doing some sort of training.
Bear with me, guys.
Yep.
Judy, I'm sorry, could you repeat what that extension date was for the flu shot? Did you say September 30th?
Yeah, I'm just throwing out September 30th, but
Okay.
it's an option, if we could do that to say, because you don't want to get your flu shot too early.
True. This is Charmaine. I just wanted to mention that, number one, really great ideas. Awesome. One caveat that we have discovered with Florida Blue is that if we extend this wellness year, it's going to delay the start of the next wellness year. So if we extend it, let's say through September 30th, Florida Blue will need a 30-day window blackout period. So the next opportunity for the following wellness year to start wouldn't be until, let's say, November 1st. So that would be a shorter period of time in the following year to earn your points or to complete the activities rather. So just something to consider.
Yeah, and I think it's important to have all these considerations on the table because that's what we should be doing. And I want to make sure that we have a robust discussion and really think about all of the options, even if it means, we're slightly more creative. I mean, I did go for the COVID-19 testing, not because I'm exhibiting symptoms, but because I wanted to, make sure I'm not part of community spread and I'm not aware. And if someone would have said that we would have had a drive-through health clinic on campus, a year ago, I might have laughed. But it was very, they were very efficient through Allied Health. This, we would have to work with the vendors to see if they could make it possible, if it's cost effective and if it could be organized as well, where we had appointments ahead of time. I just got a message, and everyone in our group did get this message. I'm going to share it for the audience who can't see the group chat. But Charmaine's point is very important. It would be hard to really, HR wouldn't necessarily want to recommend extending those dates for the reasons that Charmaine laid out. Also, just from my perspective, when we are electing our benefits for 2021, it's helpful to know whether or not we've earned the wellness reward, because that has some real cost implications in terms of how much money's coming in versus what plan we might choose. Remember that the employee share of the premiums are not tethered to our wellness program, but for someone like me, it's nice to know that, if I'm choosing the PPO at 50, that wellness reward is going to help offset that out-of-pocket costs for me. So I think that's another kind of employee kind of centered reason for not extending. Other comments?
Okay, so I didn't understand what you just said. Also, I had some other things I was going to throw out there.
Okay.
Are we brainstorming or are we in the evaluation stage?
We're kind of doing a bit of both because I think it's kind of human nature to want to do both. Paul doesn't have his video on, so he might be doing this, but it's both. I mean, brainstorming is, we should be brainstorming because the list that I put on the PowerPoint is by no way inclusive of every possible idea out there. So I will add more from your list, Judy.
Okay. But I wanted to go back to what you said about the dates because I'm really not following. If we extended it out to the end of September, that just means then you have to have a blackout date before you start the next one. But that doesn't impact being able to make the payment in at the end of December for the first check in January.
No, it doesn't, but it might be helpful for folks to know that they've earned the reward. I mean, as in ending in September, you know, as long as you got it done, you would know by that. When this assumes that our open enrollment will start that second full week of October, or first full week of October. But the platform, how it gets tracked, which is what Charmaine's point was, is that if we leave the Florida Blue system open, they do require a 30-day closeout. My point had nothing to do with the system. It just had to do with families kind of budgeting whether or not they're going to earn that reward when they're selecting their benefits.
And Judy, just to piggyback on Tracy's comments, we get retrospective reporting. So if employees complete their wellness activities by September 30th, and then there's the blackout period in October, the earliest we may hear that Charmaine attained her wellness reward for the next year wouldn't come in any earlier than November, possibly. So at the time of open enrollment in October, the employees would not have assurances that they had completed what they needed to do, because we wouldn't have that data available to us yet. Because it's claims based, and because it flows through the Florida Blue claims system, that's why it's retrospective reporting. It's looking back, it's not looking ahead, it's not current, it's not daily. So that would be that hitch.
Again, I'm just not seeing that it's a hitch. If I know that I've been to the doctor and I know I did my blood work or got a flu shot by the end of September, I know that I did it.
So if I could throw myself under the bus here, at our last meeting, I had messaged to Denise to say, I know that I went to the doctor and I know that I got my blood work. I'm disorganized. Which category I fell into, like, was that from before or was that this one? And she came back and said, yes, you're covered. So the difference is I couldn't remember which, like, when I had been and when I had done it and where it hit in the cutoffs for one period over another. And so during open enrollment, I'm kind of banking on the fact that I was organized enough to do it so that I can pick the high level PPO. I mean, the high level HMO, and $50 of it is covered. I pay $20 out of pocket, right? But if I didn't, then I'm going to eat the $70. So I agree with Tracy's point and with Charmaine's example or explanation that, you know, I'm counting on the fact that I get that reward because I'm choosing the higher level coverage, and I don't want to necessarily pay the higher amount out of pocket because I'm, you know, I'm a single mom. So, or whatever the reason. So that's why waiting that extra month would be detrimental for somebody like me who's not entirely clear on the dates as I'm doing them, and want to make sure that I get the coverage and I can pick the one that's more going to hit my pocket a little bit less. Is that?
And Judy, I can support what Elaine said. Most employees are like Elaine. So we do need to confirm it for them that they have met the goal.
And also what we have done in the past, and we'd like to continue doing, is being proactive prior to open enrollment to say, hey, dear Charmaine, congratulations, you have completed these two activities and you're eligible for the reward in the following year. So it would definitely delay the employee knowing or confirming their ability to confirm, and truthfully our ability to confirm, because if they come forward to us during the month of October when we're doing open enrollment, it's a blackout period, and they do take the system down to refresh it. So we're not going to get that reporting that quickly. I'm not saying it can't be done. I just wanted the consideration to be out there that there are pros and cons to everything, right? So this would be one of the cons to consider. So,
you know, to Judy's point about, are we brainstorming or are we evaluating, and we're doing a little bit of both. I mean, this is going to stay up on the text, assuming I don't delete it unintentionally. But let's go ahead and get some more ideas out, because I think what it helps us understand is kind of the full range or gamut of where people are thinking. So, Judy, you had a couple more suggestions?
Yes.
Okay.
Okay, so another person that expressed a lot of concern about going to both to Quest and to the doctor's office, suggested that we just simply, whoever earned it for the 2020 year, just roll it over to the 2021 year. I'm not voting, I'm just saying.
Mm-hmm.
And then another suggestion was, and then continuing on with that suggestion, for new employees, give them a period, maybe with an extended time frame to get those 2 steps completed. And then employees hired before January 31st, an opportunity to participate. Nothing for them. So yeah, so she's just proposing extending the date to the end of June or June 15th to give people more time to complete it, and just kind of grandfather in everybody that if you already did it last year, you get it automatically this year. So.
Judy, the current deadline.
Wait.
Oh.
I've got people talking over each other.
Okay.
Who started first?
I'll type mine.
Okay.
No, are you sure,
Denise.
Susan? Because you have a question right now, Susan.
Well, I just wondered, didn't they already extend the deadline to the end of July?
That's exactly what I was going to say. So, Judy,
Okay.
I heard June in one of the recommendations, but the current deadline is July 31st.
Yep. Okay. Pamela, help me out here. What else did you see in there?
What I saw was the other workshops, they weren't keen on those, but they thought that they could at least do them, or recording their steps, because they are trying to get outside and get some fresh air, standing up a little bit. I was really intrigued by the flu shot, but we'd have to make sure that those seniors that needed, I remember last time that there was a special flu shot for the seniors, that they were included. It wasn't just the flu shots that we offered at the office.
Yeah. Also, there was a suggestion, maybe we've already captured it, to allow a teledoc conference with your provider, as opposed to,
Yes.
Yeah, and I would say that falls under the yellow bucket. Allow for virtual health screening, teledoc. Denise, I thought I heard your voice.
I'm not sure if Pamela and Judy are done. I wanted to comment about the virtual health screening option.
Okay, Judy, do you have any more options, or Pamela, that you want to put out from your data?
let her go ahead and comment. I'm just flipping through the rest of the emails. I'll let you know if I find anything else.
Okay, great. Denise?
Okay. So at last meeting, Pamela did ask about the option to do a wellness exam via teledoc. We did reach out to Florida Blue, and unfortunately that is not an option because the tool was created for sick visits. However, the alternative is if your doctor offers virtual appointments and is accommodating wellness exams through virtual appointments, as long as that is billed to Florida Blue as a wellness visit, it would be picked up and counted as a wellness exam.
Denise, do we know if, so for example, I know that my doctor is doing her own virtual health appointments. So it's not teledoc, it's her own practice doing it.
Mm-hmm.
But if let's say I had a doctor that didn't offer that, is there another way in which employees could get that? So it's a little bit of evaluation, because what if my doctor doesn't do that, then I get locked out of the 2021 reward.
Yeah, unfortunately, it would have to be your doctor is offering virtual appointments in lieu of those office visits.
But that could be just one of the options that they could choose. We can give them others. And if we do have doctors that do offer it, that could be one option.
Correct.
And that's a really important point, is that our recommendation, it doesn't have to be an all or nothing basket. It could be, this is one way, this is another way, this is another way. I think what we learned after the robust kind of point system is that employees want kind of a simple 1, 2, I'm done, and they can have that conversation with their own doctor. So I guess, and again, this is the the problem and the power of being chair. I don't want my words to have any more weight than anyone else's, but as a representative on the committee, I would say that we want to be careful that we don't overcomplicate how hard it would be to earn the 2021 award. But we can most definitely have more than just one way of earning it.
And I agree with that, Tracy. And I hate to always be that voice, but also just thinking of it from an operational standpoint, knowing that we are working certainly remotely and all of those other challenges. But if we're going to start receiving completion notices, let's say through a variety of ways, it can be administratively cumbersome to handle. We're certainly willing to do it. So I don't want it to limit the committee's conversation or brainstorming. Just also to throw that out as maybe it's a selfish plea or what have you. But you know, if we're getting through claims and through here and we have to look over there, it could be cumbersome. So just throwing that out there for thought too.
Tracy, one thing that I was told over and over again was that some of the staff have to go in for checkups no matter what because of their personal conditions. So they don't want that thrown out completely. If they're already going, they want to make sure, because they have to go for yearly checkups, some of them every 3 months. They want to make sure that we don't lose that. And they have to go for blood work anyway.
And that's, I mean, kind of the whole intention behind the wellness program was to ensure that the employees are making use of the benefit. And if we're all going in once a year for prevention instead of intervention, it's better for us, it's better for the health system, it's usually more cost effective to have a preventative measure than an intervention. So
related to the wellness exams, we know that 212 employees have done it. Something that could fall under your other bucket, Tracy, is asking those 212 employees to do a physician's results form so that they can get credit for the screening without having to go to Quest.
And that assumes that they've gone to Quest. I mean, I know one out of the 212 bucket has had blood work done. She just hasn't had her paperwork done. So, and I imagine that there's more than just me. That being said, I don't know that it's necessarily every one of those 212 just needs the paperwork done. So we don't want to, in my, again, power of the chair, this is why it's hard to chair and facilitate. But, you know, we want to, I think would be worth knowing, are there more Tracys who just haven't had the physician submit the form, or of those 212, would there be a risk them going into Quest? You know, either because they're afraid, you know, to go in at this time, or maybe they live near a Quest that's already not taking wellness visits. So just to be mindful of that. I guess, do we have more brainstorming ideas? Have we exhausted kind of our creative thinking on this? I think what I would like to do now, again, to ensure that we hear from everyone, this kind of harkens back to about 1.5 years ago, where we went around the room and asked, where are you thinking in terms of, do you want to see option, you know, A, B, C, D? I know I don't have these listed as options, but in terms of A, B, C, and D, but for example, for me, I know I wouldn't recommend doing nothing. So my recommendation would not be keep the program as is. I need to think a little bit on, you know, am I in that bucket where, you know, Judy and Pamela's group had said, well, why don't you roll over the 2020 awardees? I guess I need some time to process, but my gut is roll over the 2020 people. If you earned it in 2020, you earned it in 2021. And then of these 91, 51, and 212, I think if you've done one or the other, you should be eligible. So to get the 2021. That's my quick thinking, but I might come back and speak again after I processed a little bit. But if we could go around one by one and kind of hear where's your thinking on this, what sounds the most desirable, or if you have 2 or 3 options that sound desirable, that would be helpful.
I can start. Similar to Charmaine, I would say that we want to design this so that it benefits the most people and requires the least administration manually. So my recommendation would be that we allow the alternative webinars for those that need to do one or more of the required activities. So for example, if you have not done any activities, you watch X number of webinars. But if you've done one activity, either the blood work or the exam, you have the option to either do a physician's results form or watch additional videos to complete it. And then we end the program on the date it was scheduled to end and keep the schedule going for consistency.
Okay.
Tracy, your screen is showing your private.
I know. No, it's not private. What I wanted to do was, let me stop my share. What I wanted to do was try to capture notes, and I was going to handwrite it because I'm old-fashioned. But I think what I'm going to do is open up a blank document and type on one screen, and then I'm going to bring and of course I lost my annotations. Bear with me. I lost the annotations on the Zoom when I stopped my share. So do I need to add those annotations, or Donna, if you have them in your typed notes, could you put them in a chat in case people need to see what we put up from Judy's suggestions?
Oh, okay.
Are you typing them or writing them?
I'm writing them.
Okay, never mind.
Okay.
We'll proceed as is. So Denise, it's basically if you complete 2 activities, you're good to go. If you've completed one or the other, then what would you need to do?
Watch on-demand webinars that we'll provide through Florida Blue. Similar to what we did last summer when folks could not get to 1,000 points, we offered 3 videos. And they were able to host the videos on their platform and report to us who completed.
Okay, and then what if they've done nothing?
Then watch twice as many videos.
Okay, so thank you. I'm going to moving my Word document over. So just confirm with me that you can see my Word document.
Yeah.
Yes, we can see it.
Okay. So I'm going to type as we go. So if I can get the next person who wants to share ideas, that would be helpful.
Tracy, it's Donna.
Hi, Donna.
Hey, I would just give everybody these are unprecedented times. I would just give everybody the reward this year.
Okay.
That would be everybody that's enrolled in a medical plan.
Yes, yes.
Okay.
Okay. System. I'm going to call Denise and an either or option. So this one is do program as planned. Or planned, whatever. So do the program as planned, complete one activity, and One webinar. I'm going to say workshop.
It'd probably have to be more than one.
I was going to say, what do you think of 3, Tracy? Like, if you did one activity, you complete 3 webinars. If you did nothing, you do 5. Just throwing some numbers
To
out.
put numbers out there.
Just
I like 1 and 3 over 3 and 5, but I'm only one voice. But my group has the loudest voice, for what it's worth.
If you ask me, I would say 8 videos, so don't ask me.
Well, I'm not asking you, Denise. In fact, here, this is perhaps a little unprofessional, but look at that power to mute. Like, I've unmuted you. Sorry, we have to have a little humor in Zoom for people who are watching this online. These are not easy decisions, and we know they're not easy decisions. And so, so yeah, I don't mean to make light of really important decisions, but I think at some point we have to make some really difficult decisions. And I think sometimes we have to pause and laugh and go, we are acting in the best interest of our friends and colleagues.
And to put things in perspective, these videos are 15 minutes, most 25. So it's not an hour-long commitment. So that's why supporting the more is better.
And I just wanted to say, in line with our initial charge to make sure that we had skin in the game, I think 1 video might be just passive as opposed to true effort. 15 minutes versus, an hour maybe if you watch 3 or more.
So I think I'm just gonna put here a range of 1 to 3, and I'm gonna put a range of 5 to 8. I hear faculty, even though I don't really hear them. I'm hearing them in my head going, Harbin, you said 3, but I'm gonna put 5 up there because again, this is sort of everyone is taking a chance to speak and share what options you would like to see. We're not voting on anything right now. We're just getting kind of the sense for what are we as individuals on the committee leaning towards. I see a hand from May.
Hi there, good afternoon.
Good afternoon.
It's nice to see everyone. I just wanted to say, Charmaine, could you explain what the webinar content would be and why? I think that would be helpful to the conversation.
Well, my vision would be that the videos are more or less tied to the values in the biometric screening and or where we continue to see year over year that our population struggles to make behavioral changes. So for instance, things like diabetes or hypertension or cardiac care or eating healthy. Along those lines, they would be substantial and directly related to our results. They wouldn't necessarily be, SMILE or whatever was in the prior set of videos or activities that we had through Cafe Well. So that is my thought process, that it would be directly aligned with and tied to impact where we need to see impact in our claims and in behavioral changes.
So you're saying using the aggregate data that comes in every year that identifies the top health conditions of our own employees, so tailoring it to what's going on in our population and then selecting a video based on that data. That's what you're saying?
That is exactly what I'm saying, yes.
Okay, thank you.
/shape. Okay, guys, when I signed up for chair and then said yes and keep doing it, I didn't know that I would be typing live for the world to see. So this is a little bit stressful.
Don't say anything, Tracy. We need another chair for next year, so keep it to yourself.
Sorry, but my face is probably saying like, oh my gosh, I'm looking here, I'm looking there.
No, you're good.
But if I miscapture what you are saying, just let me go back. I will go back and fix it. And then Donna, I will save this document. In fact, I'm going to do that right now. And that way I can send it to you when we're done. So.
Okay, now I'm going to take a photo of it too.
Okay. All right. So we've heard from Denise and from Charmaine, and that kind of helped us round out the either or option, meaning do it as planned. If you've done one, we'll do one, and then you have a subset of workshops. Or if you've done none of the activities, then you have a series of workshops, and there is some debate over how that would be shaped. I have a hand from Susan.
Okay, I was just going to give my opinion that if we're going to do some alternative, I would think we have to do like workshops or something, and it has to be, I would go with the 3 to 5, the more, because it has to be some effort. But I think the idea of doing nothing, since it is likely, or not maybe likely, but there is the possibility we will not get a vaccine. We're going to have to figure out a way to live with it, and just never going to the doctor or to get blood tests is not going to be an answer. Looking beyond this one coming year, that are we still going to be too nervous in a year from now? I mean, that at some point in time we're going to have to decide that we can just adjust to it. I'm not trying to rush people ahead of what they are, but I think that's a reality that we're going to have to face, that it's not like next year we're necessarily going to have a vaccine and everyone have the vaccine. So I mean, at some point in time, we're going to have to just accept that we are going to be living with this. And
Susan, to that point, I think it's a really important point to consider when we're talking about how do we shape the wellness reward for 2022. Because, if we are committed to offering this incentive for folks to stay on top of preventative health care, we are going to have to maybe be slightly more creative in what we offer. And I do think that it's important to recognize that we can't substitute everything for a virtual environment. I don't see how you can do biometric screenings virtually. Although that being said, the idea of doing the drive-through biometrics, maybe that's something that we use for the 2022 reward, where it gives us more time to set that up, and it gives an option where people can come to a campus that they already know how to get to, and they know how long it's going to take them to get there, and then they can navigate that campus to get the biometric done. But I don't want to conflate our 2022 discussions with 2021, but I think that we have some really rich ideas that will help us, perhaps not this meeting, but the next meeting where we discuss the 2022 reward.
No, I understand. I'm just saying that keeping it kind of in the back of our mind, that to do nothing is, I mean, if I'm voting right now, I would vote for workshops as to do. You can either do the 2 or you can do the workshops.
So far I've heard from, you guys have heard from me, we've heard from Donna, we've heard from Susan, we've heard from Denise, we've heard from Charmaine. May is here as a guest, but we've heard a little bit from her in terms of getting that clarification on what the workshops are. Susan, I know you're new to the committee. I think, like myself, we definitely came in on interesting times. So Judy raised her hand, so I'm going to call on Judy, but then I will circle back around so we can kind of hear your thoughts, and then Elaine and Pamela and David and Nancy.
So I just wanted to circle back. It sounds like we have already ruled out the option of doing something on our campuses for this time around.
I think what I heard Charmaine say is we don't want to make things too cumbersome. Anything that I'm speaking to is just my perspective. It's not a shutting down. I think at this point, a recommendation is just that. And if we feel compelled to recommend, doing something on campus for the biometrics, then that's something that we can definitely vote on. So in my purview, and if I've over-directed, I apologize, but I don't think there's anything off the table. Right now, I simply want to get everyone a chance to speak and kind of tell us what seems most appealing to you or your constituents.
Okay, well, I would throw that one out. I like that idea. Either drive-through or on-campus biometrics in middle of July. Because like Susan said, we're gonna have to do this stuff. We're gonna have to figure out how to do it.
And I agree with Judy. I think that's a very solid proposal. However, it is also very dependent upon Florida Blue and whether or not they have the capabilities to support us and whether or not their employees feel comfortable doing so as well. So I can tell you that I wouldn't be able to give direction on whether or not it's possible during this call. It's something we would have to reach out and research with them.
In terms of the drive-through, I would assume that those would be performed by staff at Quest, not staff at Florida Blue. So then again, is that even a service that's available, and can Quest support that?
May I ask a question on that regard? Denise, who used to do the, when we did the health screenings on campus in C building, and they would do the stick and stuff?
That was a finger stick, and it was a contracted vendor hired by Florida Blue.
Okay.
And they did not do
right
the intensive screening that we're getting now at Quest.
Right. Okay.
And Tracy, I'm going to ask you, can you help me define what a workshop is?
It's the webinar. Do you want me to change that to say webinar?
Yeah, I think of something in person when I see workshop. Thank you.
Okay. Allocation or on campus. I'm just going to leave it on campus. All right. Who's up next? Pamela.
I want to say I love the idea of the drive-through screening. I like it a lot. I do have more than one employee that catches rides from other employees to get back and forth from work. So if they haven't already done it, I'm trying to remember which ones are full-time and which ones are part-time, because of course that's a difference if they have health care, but it might prove more difficult if they don't have a car. I don't know, and I would certainly be happy to pick up any of my staff to do it, but I'm just saying that might be a concern. I think that we could go back and look at anybody that completed it last year and roll it forward. And anybody that was new that started this year, you know, maybe they've already done one, but they couldn't complete the other, then complete the workshop because at least they've shown effort.
Okay, so transportation. So can you restate that for me, Pam? So Pamela, so basically the 2020 awardees would roll over.
Yes. And then anybody that's new that said, oh, I could have done that because we have employees that have figured it out. Then if they've at least attempted one, maybe we could give them a workshop for the other.
Okay. Automatically.
Might be easier. I'm trying to think of what's going to work. I know that the teleworking isn't easy when it's a lot of paperwork. So I hear what HR is saying, and I don't know what the easiest way to deal with this is for their office.
complete, I'm going to call it the either or option.
Okay.
Okay. Let's see, we still have David, Nancy, and Susan, and Elaine.
I'll go.
Okay.
So when I asked, I got my athletic and active people were saying that they were fine with some kind of activity tracking mechanism. A couple other people said that waive it or roll it over from previous. And I was trying to find your bucket. I didn't know where your bucket list was, because there was one more that was on there that somebody mentioned to me and I couldn't see it. Sorry. I don't know if that complicates the world.
Can you see it now?
Mm-hmm. Yeah, so it was give everybody. Let me get rid of my chat box. I'm sorry. See, Judy, I'm very disorganized. Okay. The credit was one of them. The roll it, keep the program as is, no. And the workshop, the web. Okay, so yeah, so the activity tracker, keep it, like roll it over. And I'm in favor of the credit for one or the other, or both, and then the webinars, so.
Okay, so we have all of your options up on screen on the Word document.
Mm-hmm.
Super. Thank you. Nancy?
I would recommend to do the webinars. I think because everyone's working remotely and there's a lot of people that may have a fear to go out to the doctors or go to Quest. So I'm in favor of the webinars.
Super, thank you. David and Susan.
I'll speak. I also like the either or option with the webinars, especially since so many people have completed at least one or the other. And as we say, we kind of want people to have some kind of skin in the game. So I think that's a good option.
Okay, great. Thank you. And then did I get everyone? David?
Yeah, I agree with the either or option as well. I think it'd be a little bit tricky to do anything complicated with just 2 months left. It just caused a lot of confusion, I think. So yeah, I like the webinar option. It seems simple. It seems doable. It seems like everybody can do it and demonstrate some effort.
So, thank you. Is there anything else that you want me to add up there, or we've captured it all? I think we've captured it all. All right, then, Elaine.
I was just going to ask, so when I have to look in one and I look at the other, I lose vision, so I just keep my glasses off. But this takes into account that if your doctor is willing, you still can do the virtual appointment with your doctor and submit the form. That doesn't change, correct?
Yeah, I mean, it's our recommendation. So that's part of the do program as planned. As Denise said, that if your doctor, I mean, it's all contingent on your doctor offering the wellness visit. So yes.
Okay.
Yeah. So, and it really would be do your doctor's appointment. If you have your blood work not done, then there's a series of webinars. If you have your blood work done and not the doctor's appointment, then you could either try the virtual one, or there would be a series of webinars on the importance of preventative care is what I'm imagining. And then there would be a different series of webinars, for those who need to have the blood work done, because you need to understand the importance of knowing your numbers and doing something about it. And I think that it's kind of maybe outside of the purview of the committee to get into the webinars, but I suppose that if HR wanted a subcommittee to kind of advise on what webinars, that could be an option. But I definitely don't want us to go down that rabbit hole right now in this meeting.
I think we've got it.
Okay.
Tracy,
Now,
Tracy,
yes.
Charmaine, under do program as planned, just so we're clear that we're not saying that we're taking away, one doesn't eradicate the other. So to do the program as planned, you can do it exactly as it's planned. If you so choose to go to Quest, if you so choose to see your doctor, you can. But I think it would be good if we noted that this includes the virtual wellness visit, dependent upon the individual physician. Because again, if it's up to the physician to offer the virtual wellness visit, and then they would have to file the claim just as they would if you had showed up in their office. So I don't want anyone to think that it means that you cannot do, you know, a virtual wellness.
And to me, also do the program as planned means that if you're comfortable and if you want to, you can schedule appointments in July and still continue to go to Quest. As I mentioned last meeting, Quest is still open. You just have the requirements of wearing a mask, doing a temperature test. And I'm planning to actually go there at the end of this month, so I can let you know how that goes.
All activities would have to be complete by
July 31st.
And would that include the webinars, or would we do an extension on the webinars?
That would be inclusive of the webinars. At this point, we have, 8-9 more weeks to go. So it would be inclusive of. We would get a communication out ASAP. And so from the point of the communication through July 31st, however many weeks that works out to be, that would be the end date as well.
I have a hand from Susan and then a hand from David.
I think actually that Denise answered my question. So you can still, so I've gone now and done my wellness check and I've got my appointment for the blood test. That will still cover me. I won't then have to go and do workshops too, right?
Correct.
Okay. That was my question.
David?
Yeah, I was just wondering what the timeline or logistics or mechanics of getting the webinars up would be like. Would it take 2 weeks, a week, a month?
At this point, I would say possibly no more than 2 weeks. We have the video we have their library of available videos. I suppose once we just review them and we get a communication or once this is all approved and ready to go, once we pick out the videos, put together a communication and we send it out college-wide, I can't see that it would be more than a 2-week time frame at maximum.
All right. So there are 4 options on the table. It sounds like we're starting to reach consensus on 3 of them, at least what I'm hearing. And if I'm wrong, let me know. But it sounds like awarding everyone the medical plan is just not, I'm not hearing big consensus on that. I'm hearing some voices, here and there. To Susan's question, it's not so much about the board approving the plans. The next board meeting is in June. And so it's about the recommendation going to executive team. And then when executive team decides on the recommendations that we make, it'll be yoked into the budget. And so at the next board meeting, it will, the budget, hopefully, fingers crossed, if the governor gets legislation, will be approved. So it's an if then. It's not that the board is going to get into the nitty gritty of the wellness program. They leave that in the hands of the VPs, and the VPs leave it in the hands of HR and us to make those recommendations.
Okay, so but what my question is that if we're talking about a timeline for people to do the workshops, once we're done here, and I'm assuming the executive team meets at least weekly, if not more, then once they've said yes, it's a good for go, or are we waiting for some other approval before we, get
no, it's a good to go. It's just getting their agreement that it would be acceptable to have people meet the wellness 2021 requirement through other means than what we originally set out.
Okay, I was just thinking that if the board had to do it and they didn't meet till June, now we're.
Yeah, no, and the money's already been established for the 2021. Well, we're offering it, so I guess it's already yoked into the budget. So we will have to start thinking about the 2022, not this meeting, but I don't want to lose sight of the suggestions that we have. So I guess, I have a suggestion that we vote on each item individually, because there's not something that says we have to only take one recommendation to the board. We can share the discussion and let them know kind of where the will of the committee relied. It's a little bit different than just saying that we have one solid recommendation. Would you guys be comfortable with voting on each one individually, knowing that you could vote on every one if you wished? So does that make sense, or do I need to repeat that?
Got it.
Got it. So independent, can you guys, I'm gonna clear the thumbs up. I've got one, maybe I can't clear it. Actually, just raise your hand. So if you're in favor of, well, now I can't tell you how to raise your hands.
Is it the thumbs up?
Yeah,
We only have the thumbs up. I don't see the raise a hand anymore.
Okay. I guess to do the thumbs up though, you need to
The raise the hand is in the participant list.
so if you go down to the participant list, there's a yes or a no. So for example, if I click yes, that records one yes. So if you you can also go there to the more to do a thumbs up or thumbs down. So let's use the thumbs up, thumbs down, because it'll be easier for me and I think we'll be able to see them. But if you're for the yellow option, give everyone the reward who is enrolled in the medical plan, can you give a thumbs up or a thumbs down to that? So I am seeing, Denise, can you see the thumbs as well?
Not all. I'm trying to scroll.
Tracy,
Yes.
thumbs up, but I don't have a thumbs down.
So when you're in the participants list and you click on the more,
Oh, okay.
there's a thumbs down, a thumbs up, an applause, a coffee cup, and a away. So I'm asking folks if you would use the thumbs up or thumbs down on that one. Let's see, I'm seeing mostly thumbs down. I'm seeing 1, 2, 3, 4, 5, 6 thumbs down, and I am seeing 2 thumbs up. Charmaine is non-voting. May is a guest. Nancy, you're non-voting or you're voting?
None.
None. And Susan voted. So, all right. So just for the record, there were 2 thumbs up and the rest were thumbs down. Do you have that, Donna?
Yep.
Okay. I'm going to go ahead and clear all. And let me edit undo. And let's come back here and have I mentioned the stress of doing this? We're gonna go and look at, now we're looking at the either or option. So do the program as stands with possibly a virtual option if that's what your doctor offers. If you've done one or the other, then a series of webinars. If you've done neither one but wish to participate, then there'll be a set of webinars. Everything will be done by the 31st. So we have a few more votes coming in. If I move, can you guys see the chat, the participants list on top of the Word document or not? On my screen share?
I can see it when I go to the participants list.
Okay, everyone can see it if you go to the participants list. Okay, I'll leave it here so the public can see it because Ken is capturing, the IT folks are capturing the screen share. So I will just do it for purposes of public as well. So again, Charmaine is non-voting, May, Ken, Nancy's non-voting, and Paul is non-voting, and Susan's voted. So we have a unanimous thumbs up on option 2. Just let the record reflect that. Option 3 is to keep the program as is. So basically there would be no webinars, and we would try to offer a drive-through biometric screening on campus. Thank you for clearing those thumbs. So if you could give me a thumbs up or a thumbs down.
I have a question on this.
Yes.
So you're voting, if you would like to have a drive-through, you have to vote for keep the program as is?
For this particular year, yes, because we didn't put a drive-through option there. We can, again, we can sit down after we've taken each vote to say, is there anything else that we want to add? What are you thinking, Susan?
Well, I mean, I'd like the drive-through option, but I would really think the best is the either or. But I'd like there to still be a drive-through option that then you could just drive through and get the stuff done, you know, literally in your car. So the and is what kind of, it seems like they should be two different things. That because if, you know.
So I think you could do the program as is in terms of if I were comfortable going to Quest, I would go to Quest, I'd see my doctor. But then there would be an alternative where if I weren't comfortable going to Quest and the school could provide the drive-through biometrics, then that would be a choice. You know, again, if we need more options on the table, I just wanted to get a sense for where are we right now in terms of getting to a recommendation.
No, I just didn't know that was. As like right now, I probably would vote no, because I don't know that keeping the program is the majority of people would be comfortable, or at least there'd be a sizable minority who wouldn't. But I like the idea of the drive-through. So is there another way that or should we wait for next year? Because that's really hard to get organized in the last 2 months of.
And that's why I'm personally voting for a thumbs down. I don't think that we should take it off the table for 2022, but I think to ask our HR team to make that happen with our vendors within the next 10 weeks is going to be Elaine's task. And I'm not sure the vendors would come back and say yes. So I kind of want, me personally, I want to see a plan that we know we can get done in the next 10 weeks. But I would love to see that for 2022.
I agree with you, Tracy.
Yeah, I agree.
So that's good. I think it's always just good due diligence when we explain why we give a thumbs down on that one. So I am going to highlight the last one, which is.
Did you want to count?
Yeah, what was the?
Ouch, I'm sorry.
It was 3 down. It was 3 down and the rest were up.
Okay.
Susan, myself, and Donna were the thumbs down and the rest were up.
Oh.
Sorry for that. What's wrong, Elaine?
I was a thumbs down.
Yeah, I thought there was more than 3.
Okay, can we
revote?
Yes, please. I think we had some votes change, but that's okay.
I was thumbs down.
Okay. Well, now I'm seeing 7 thumbs down and 2 thumbs up. Is that correct? All right. Then last but not least, and the way we have this one worded from Pamela's suggestion is that we roll over all of the 2020 people who earned it. And then for people who didn't earn it in 2020 but want to earn it for 2021, it basically brings us back to this either or option. So it's a little more inclusive than just the either or, but it also, I know some of you voiced concerns about kind of doing nothing. So right now I'm going to clear. These are the votes from the previous round. So I'm clearing this. And so if everyone could cast their votes for this last one. All right, so we're at 9, which is what we've been getting. So we have 3 thumbs down, 6 thumbs up. Just for a reminder, this one had the second most positive votes, and this one had had a unanimous vote. So I'm going to move this off the screen for a second, because when you get to my next slide, it is committee recommendation. So I'll bring my Word document maybe back over if it lets me.
Tracy, I'm sorry. I think we're missing a recommendation. We may have talked about it, but I don't think it made it to our voting list.
Okay.
And that was to extend the program and not do videos.
Well, so a couple of things. The list was generated by us going around one by one to see where we all stood at the time. We can definitely add more options, but these are kind of what people were thinking of at the time. Do we need to add, let me just do my due diligence here and ask, do we need to vote on any more options?
Based on the feedback that I'm getting from employees, who are the most frequently asked question is, can we have more time? So that's the reason I'm wondering, do we want to talk about that as an option? Should we give them more time and then talk about what does that look like? Is it 1 more month, 2 more months?
Did people know it was through July 31st? Because
yes, they did. So I can count my inbox right now. It's, will this be extended? Will this be extended? That's the most frequently asked question.
I think it might be because right now there's a big question mark, right? What's going on with the wellness program? How is it going to look? How is it going to work? So in my head, this is my interpretation, is that if in my head, I think there are not going to be any changes. There are not going to be any options. I only have till July 31st to do this. I'm uncomfortable. Can I have more time? In my head, that might be the genesis for these questions. Mm-hmm. I'm not saying that I don't know. So certainly I'm not a voting member, but if that is something the committee wants to vote on, I recommend that you do. Just bearing in mind, obviously, any sort of extension beyond July 31st is going to delay the beginning of the next wellness plan year and may very well have impact to communication prior to open enrollment, as we had discussed before. So it would not be my recommendation to the committee that we extend it, especially if we're going to, champion for this either or option.
Right. I was just wondering if we could just have it as one of the items we talked about and voted on.
I'll leave that with you, Tracy.
Yeah, I think that it's probably a good idea, because Judy mentioned it in some of the suggestions that came from her constituents, because when they said to extend it till September, that indicates an extension. If you have people who are asking for the extension, then I think we can vote on it. I think in terms of final recommendations, I think that we need to decide, if we get down to these 2 that we have highlighted in yellow, and I have to make sure that we're comfortable taking the other 2 off the table, do we need to do the extension? So I by no means want to use the power of chair to prevent us from voting on something. So extend the wellness completion time frame. I mean, I heard Judy specifically say the end of September, but I haven't heard anyone else say extend it to a particular date, unless I am misremembering.
I didn't hear any other dates also. And I think that, you know, the employees don't necessarily understand that it's going to shift everything over also. And then May had a comment in the chat as well that said, I think that once everybody sees that there might be another option, then that the question mark will kind of be answered and the fear will be alleviated. But I agree that it's going to take us not very long to put this on the table and vote it. So I think that's a good idea.
Judy, you had a hand too. Oh, hang on, you're muted. Let me unmute you. I am muted. Well, maybe.
Okay. Just to be clear, what I had proposed was twofold. One was an extension of the wellness plan to the end of September. And in addition, that the flu shot be exchanged for the biometrics. That was the recommendation from one of our constituents.
Okay, so do you want me to include that on us to take a vote on to see where the committee is and put the flu shot on there? Or do you want me to, do we need to have a vote on that? Or do you want me to take Denise's proposal and just talk about, do we extend the wellness year and deal with the consequences of extending that?
Well, the only reason I mention it is because you were saying that you were throwing me in with just extending the existing program. That wasn't really what I was proposing.
Okay.
I was extending the so that we could get the flu shot as an option.
Okay. So good. Well, that's fair. Thank you for that correction, because other than the emails, Denise, I haven't heard other people advocate for extending the time frame, but we can definitely vote on it just to see where the committee is. But do you have a proposal for how long you would extend it then, Denise? If
Let's say, I'll go with Judy, September.
Would that have, beyond just next year, would that have reverberations all the way through? Like even if we switched, left Blue Cross and went to someone else, is this going to mess us up for repeated years in the future, or is it just next year?
It depends on it depends on how you want to set it up. Remember, the first year we didn't give everyone 11 months to get the work done.
Right.
That's why it double counted. So, I think if we were to shorten at some point, if you wanted to get back to a September, July timeframe, you would have to shorten the horizon, whether you did that for the 2022 or whether you did that later on, or whether you went back to a double count the way we did the first time. That would have to be taken up for the 2022 design.
Okay.
Is there any more discussion that we want to have on extending the wellness completion timeframe? And let me just pause, because our meeting was originally scheduled till the end of 3:30. If the IT folks can just maybe send me a message and let me know that we're still live, because sometimes that live feed drops right at the end of your meeting. I don't have it on the screen, the live feed on the screen, because I would have feedback if I did. So, Ken, are you?
I still see you, so.
No, we can see each other on Zoom, but we are being live streamed.
I see, right, yes, it's
15 seconds.
Right, okay, I got it.
And I know in the past that whenever your meeting time is scheduled to end, the live stream cuts off right at that time. So I just want to be certain that we are still live streaming.
Tracy, it's Donna. Yes, we are still live streaming. I just got a text.
Okay. Thank you. Okay, perfect. All right then. Thank you. I wanted to make sure that we were being available to the public. All right.
Tracy, can I get clarification on one thing?
Yes.
So I don't know when flu shots come out, So, but I'm feeling like that's an important part of the extension to September 30th.
No, that's a completely different discussion.
Okay.
The flu shot extension's was a different suggestion. And that's why Judy made a point to say that hers isn't just extending the time. Right now, we're just talking about, do we give employees more time to complete the either or option?
Which was from the Denise's conversation.
Yes.
Okay, thank you.
That's
I'm
right.
there again. I'm back.
Okay. Any discussion on it? Then would we like to take a vote again using the chat feature with the thumbs up, thumbs down?
Tracy, would you like to clear? I don't want to touch it.
Yes, I'll clear. Sorry. Okay. Hang on, I'm changing my vote. I want it down. I'm clicking the wrong thing. All right, we're one vote short, but someone left the meeting, so I didn't get to see who left the meeting, if it was a voting member. We still are good on quorum, so we have more than half of us here. So that's 8 thumbs down on the extension. Okay, I'm gonna clear that. So then in terms of our recommendation, do we want to send 2 recommendations forward, the either or option, along with the suggestion of rolling the 2020 reward recipients forward, and we let the executive team decide which option they want to see, or do we feel compelled as a committee to only send 1 option forward? There's not a right or wrong to this. We can definitely send 2. We can feel compelled to only send 1.
I think we should send 2.
Other people? So yeah, let's go ahead and, so just go ahead for the record, and if you're comfortable sending 2 options, can you give me a thumbs up? And we're at 7. I lost my 8th one. All right, well, I'm gonna go with 7 then. So I will email this document to Donna for the minutes, and I will also email it to the HR team, and that'll be the things that I have highlighted in yellow will be our recommendation.
Tracy, I'm your 8th.
Oh, thank you. Okay, good. It's like, what happened to the 8th? Again, we're 5 minutes over time. We have the update on the RFP. I'm not sure if Denise or Charmaine's going to take this one.
I'll take it. I'll be really quick. So as mentioned in our last meeting, the consortium had put out a request for proposal to the marketplace for vendors to come forth and bid for the consortium's book of business. So 3 vendors, the incumbent Florida Blue, United Healthcare, and Aetna, they all bid, and over, I would say this past week, sat through a series of presentations of at least 2 hours apiece, where each vendor had an opportunity to talk us through or walk the committee through their value propositions. The committee was comprised of the consortium, members of the operating committee, which is also business officers from different colleges in the 28 college consortium pool. And we had HR representatives from, I believe, maybe 4 or 5 colleges. And so I felt very privileged that we were asked to be a part of the discussion and the review. The conversations were very robust. They were very interesting to hear from other vendors, what type of services they could offer to us as a client, and how they would service our account. The long story short is that after, I think it was I think all week this week I've had maybe 8 hours of sitting in front of my computer listening to this. The committee made a recommendation to stay with Florida Blue, and they will be putting that forth to the operations committee and onto the council of presidents if nothing else changes. But that was the final determination after evaluating cost and bells and whistles and dedicated service reps and pharmacy in and pharmacy out. Many different variables were considered and reviewed. The final decision was to remain with Florida Blue. So I just wanted to give that information to the committee, and we're just the next step is the operations committee. And I don't know, May, if they're going to be reviewing that as soon as this Friday or next Friday, whenever it is that they meet, or if it's designed for a later date. I cannot remember. So if you're there, can you just let me know? Remind me.
Yes, I'm here.
Okay.
The operations committee meets Friday the 22nd.
Next week.
And that's when they'll hopefully adopt that recommendation and then pass that along to the Council of Presidents for final approval. But due to the financial plan that was presented, the costs, I think it's in everyone's best interest to stay with Florida Blue as the medical vendor.
Do we know if the plan choices will be the same as we have now?
Well, I can say that the committee and the vendors, we did not drill down to that nitty gritty of detail. It was more of a high level 30,000 foot overview of how the account would be handled. I do know that the information that the consortium provided to support the RFP, all of aggregate claims data, things like that, our plan designs and what have you, those features were taken into consideration to build into the costs that were presented to the committee. But we did not get down into deductibles and, ER costs and in and out of network and anything like that.
Okay. All right. Any other questions from committee members? Okay, seeing none. The SSC budget workshop, let's see, Judy had to go to another meeting. I know that I sat in and listened to the board meeting. I know that May listened as well. The budget is right now, it's just kind of a continuance of this past year until the legislative body sends the governor the budget. When the legislative body sends that budget, the governor only has 15 days to act on it. He could do anything from line item vetoes to vetoing the whole thing to signing the whole thing. And so the point here is we just don't know. And so what the school has planned for is a continuation on of fiscal year 20 for what will be fiscal year 2021. They are going to, if memory serves me correctly, there was a $1.4 million shortfall that they were going to pull money from auxiliary funds as well as from reserves. They are budgeting 6.5% increased costs for healthcare. Whether that'll be our final number or not, this committee has been talking about a 5.53% increase. But again, for budgeting purposes, you always want to budget just slightly more in case those numbers look a little bit different, especially because that RFP is still out there for the consortium. So in terms of how the budget impacts us, we kind of are price takers in terms of that's what the insurance cost. I think that at our last meeting, there were a few people who had voiced concerns in terms of we want to make sure that the employee cost share does not change, especially in the time of all of this economic uncertainty. We don't want to pass burden on to the employees. We know that there won't be a raise in compensation given how the budget's looking. So I know that I would be rather upset if we saw employees sharing more of the health insurance. And I know a few other people felt that way. Does anyone want to comment more on the budget or kind of where we are on that. And Judy is coming back in. She was in the waiting room.
My understanding is from the budget that isn't it going to all completely change, because the budget that the legislature passed was like what, in January or February, before everything fell apart? So aren't they going to have to pass a new budget?
Not necessarily. They are holding on to the budget intentionally, because the governor may come back and say, rework it before you send it to me. A lot of it is contingent on how much we are going to get in federal funds to offset those costs. I mentioned I did an AFC presentation last week on legislative session. And in that session, I mentioned that analysts are saying that the economic cost to Florida between the loss of revenue as well as the increase of expense for things like Medicaid for Florida Healthy Kids could be anywhere between $8 billion and $10 billion. And so some of how our budget, our Florida state budget, is going to be impacted is going to come from how much does the federal government give to states to offset that impact. The other aspect which Joe talked about at the board meeting is, given the fact that it is an election year, the politicians may not want to touch education in terms of scaling back on some popular measures to support education. So we may see education unaffected in the short run. In the long run, there's nothing to say that they couldn't come back and do budget cuts in the middle of the year and ask us to be more frugal. So there's a lot of unknown, but right now the legislature has not been asked to rework the budget. The budget that they left with on March, in the middle of or the end of March, is the one that currently stands, but they intentionally held on to it so the governor didn't have to act on it until he had fuller information. And
Okay.
Judy, anytime you want to jump in, or I know May listened and I don't know who else was listening to that budget workshop, feel free to add.
With respect to the state, the only thing I would add is I think it's actually quite likely that there will be a budget cut mid-year. And I think, because state revenues have been devastated by this, both the tourism tax and the state sales tax. And they're already looking at what reserves can be used. And that only gets you so far. So I think it's very, very likely that we will get some significant cuts mid-year.
And I will say, the chair of the Board of Trustees it did say that if there's ever a time to use reserves, it would be now. So the board is definitely recognizing the fact that this is just unprecedented times. So they're not necessarily afraid to cut into reserves. But that being said, and I'm not a board member and I'm not a member of executive team, but we all know the law. We do have to keep 5% in statutory reserves. So if we dip below that 5%, at some point we will have to tighten the belt to get back to the 5%, should we need it for, say, a natural disaster or some other emergency. Judy, is that fair? Or?
Yep, that's true.
So the budget is another wait and see. I think, in terms of the talking heads, they're anticipating the governor to ask for the budget by the end of March. I know that there is a second CARES Act that's going through the U.S. House of Representatives. There tends to be a little bit of a political quagmire with the Senate. So whether that'll pass or not is yet to be seen. If that passes, or some form of that passes, there is some relief built into that for states. But it's all hypothetical at this point because nothing has passed. So we are very much in a holding pattern for now. Susan, I see you unmuted yourself. Do you want to jump in?
No, actually, because I made the question, so if I had to respond, I wanted to be able to.
Any other comments or questions about the budget or how our work might be impacted by it? Okay, then seeing none.
Actually, I do have a quick question, and I'm sorry. I tried to watch the budget workshop, but I had some sound issues, so I didn't hear all of the statements quite well. I thought I heard Joe mentioned that we had some savings for health plan spending, and I wasn't quite sure what that referred to.
The savings that he talked about was the fact that we have an employee cost share that he shared with the board to remind them that, you know, we still have employees at having skin in the game. That's how I understood that comment. Judy just raised her hand, so let me turn it over to her.
No, I'm sorry. I was raising my hand on something different for open discussion.
Okay.
I don't know what the comment was. You know, with respect to savings, the only savings that I'm aware of resulted from a shift in plans, where we had some people move to less expensive plans. I think there was some savings generated from that. Does that sound like the comment he made?
Yeah,
Yeah, it was.
So. Okay.
Yeah.
Okay. When we're done talking about the budget, I had a different item for open discussion.
Okay, I'm done with the budget. Are there any other comments that folks want to make about the budget? Okay, seeing none, then Judy, why don't you go ahead and do the first open discussion comment?
Okay, and I apologize. I had to drop out for a few minutes because I had another meeting I had to launch.
Okay.
Come back in, so I missed about 10 minutes there. So I don't know if
you just missed me talking about the budget. Your timing coming back was perfect. So
okay. All right. So what happened? What I was curious about is that my understanding is that CAC is evaluating or has already evaluated requiring or changing the requirements for this committee to only meet twice a year. And I was wondering how that originated, and should this committee be aware of that, and just can you share what the process was there and the thought process?
Yeah, so and Charmaine and Denise can jump in as well. There were a couple aspects to that, because I believe that procedure, which Paul just emailed out today, includes putting Paul on the committee as a non-voting member, because he does represent the school for purposes of bargaining, and this is something that is technically bargaining. We're going to add him to the committee. The other part is some years we do a lot of work, and some years it really is just a reference point. There's nothing to say that it's not phrased in a way where it's like we only meet twice a year. It's just the minimum number of meetings. So like this year, we did not have a lot of work early on. We had one meeting in September. We didn't have our next meeting until April. And then we had a third meeting today, and it sounds like we're going to have a fourth meeting before the next fiscal year starts to talk about the 2022 design, as well as the medical offerings for 2021. So I think it's really more about the minimum requirements for years where we're just kind of studied the course. The last few years, the 3 years I've been on the committee, nothing has been studied the course. So we've had more than 4 meetings, which was the minimum. So that was the thought process behind it. We don't want to waste people's time with meeting just because a procedure says it. At the same time, by having a minimum, it doesn't mean that that's maximum, right? So.
That's exactly right, Tracy. The impetus behind that was that exactly what Tracy said. In some years, we need to only meet twice as a check-in. Here's what we've got going on. Here's what's coming up, and really that's it. In other years, was it 2 years ago? It was, we met, 20 times maybe. It just depends. But to have a minimum of 4, we felt that was a slightly, I won't say excessive, because we are important and our benefits are important, but to have a minimum of 4, we felt sometimes we were just straining to fill an agenda, and we were just meeting just to meet. So we wanted to make it value added and to really show the importance that we place on it. So that's why we proposed definitely a meeting in the fall term and a meeting in the spring term. And certainly it is up to the committee and what's going on at the time to say, let's have 6 more meetings. It doesn't limit how many times we can meet. It just gives us a minimum, a floor. And quite frankly, I believe out of the 11 standing committees, this committee was the only one with that type of a 4-meeting minimum. So it just stood out in comparison to other standing committees as well.
Okay, so just in response, I'm all on board with fewer meetings and not meeting if we don't need to meet. I guess what concerned me about the process was that this went all the way to CSC without ever even being discussed in our committee, which just doesn't feel like shared governance to me. So I just wanted to bring that up and, you know, share that feedback.
I know that Paul has a meeting at 4, but if he wants to speak to it as well, he can. What I would say in terms of the shared governance process, the way in which the procedures are written now, technically you can propose a procedure change without ever taking it to a committee. And when Judy and I were on it was then called CTAC, but now it's CCSC committee, we talked about that being a little bit of a problem because you could change the committee without the committee's knowledge. However, the way the shared governance system works is that when it goes out for public comment, that truly is when shared governance needs to happen, both from the committee members as well as the employees at large. Just because a proposal is out there doesn't mean that it's going to come to pass. And so what I would encourage all of you to do, precisely because of shared governance, is if you feel strongly, or if your colleagues and constituents feel strongly that this committee should meet, 4 times a year, then make that known, because all of those recommendations get compiled back before action is taken. So I guess to just tout what shared governance is currently at our college is that process of open for public comment, the 30 days that it stays open, that is the shared governance mechanism. And if you or your colleagues or anyone who's watching the live stream feels compelled to say, no, we want to see employee benefits meet 4 times, or maybe they should meet, once a month. Charmaine is probably groaning with her microphone off, but if that's what you feel compelled to share, now is the time to do it. So now is the time for shared governance. Paul, I know you
lost my connection. I missed whatever got on. But I was just saying that I think 2 as a minimum is a good idea.
And to that regard, if you think it's a good idea, they love positive feedback. So feel free to reply and let them know that this is a great suggestion. If you feel compelled that we should continue meeting 4 times a year, write that. Or again, if you feel compelled that we should meet once a month, then share that as well. But I would say that shared governance is now. Paul, I know you have to dash off, but is that a fair summation of the governance process?
Yeah, I think that was a good review. Nothing's final at this point. The revisions were proposed first to executive team, and then they said, okay, let's take it to CAC and let the representatives on CAC decide, should it move forward. Sometimes CAC will put the brakes on things and go out and explore other options or ask questions. In this particular case, they didn't. They approved it to get posted, so that's why it's posted. But certainly nothing's final. All discussion points or comments, positive or not positive, will be, as you said, Tracy, compiled. And all of those are forwarded to CAC for their consideration. Let us know what you think, and we'll certainly have that discussion. And if somebody from this committee feels strongly, or if this committee feels strongly that you would like somebody from your committee at the CAC discussion when it happens, I'm fine to invite somebody from your committee to be there to be part of that discussion. That's happened before as well, where people who are directly involved with a particular procedure actually come and take part in the conversation at CAC. So Tracy, if that is important or necessary, just let me know. And when this goes back to CAC, I'll be sure to invite you.
Okay, that would be great.
Needs to come.
Okay, thank you, Paul. All right, May, did you want to speak?
Yeah, I understand your point, Judy. I could get how it may feel that way. I actually thought it was on the agenda as an item. I don't have that right here on this screen right now. I thought I saw it on the agenda to update this group.
We had, so it was going to be an open discussion item. And when I updated my PowerPoints, I had the old list of open discussion. So I quickly deleted it. But yeah, I should have spoken first because that was going to be the open discussion. We had to get the agenda out for the 7 days posting. And so I didn't get it on way back when. And so, yeah. So,
yeah, I thought I saw that. But I think it's important to know that kind of the leaders of the committee, the chair and Charmaine, were receiving feedback that the committee was fatigued. And Charmaine and I talked and we pulled out the procedure and realized when we compared it to others that this committee was tasked to meet double what other standing committees were asked to meet. And I think you know, Judy, from having served on this committee, we were meeting sometimes last year, like once or twice a month. And so I definitely think this committee will meet if necessary, but we were receiving feedback that the members were feeling fatigued. And so that's what prompted the whole discussion. I like how in the procedure, the revisions, it lists that if the majority of the committee thinks that we need to meet more frequently at any time, that'll be part of the permanent procedure. So I like that revision as well. And then I think it's been reiterated that some of what also is driving this is that Paul really needs to be present since this is bargaining for some members of our staff, you know, our faculty. So all of that kind of combined. So I hope that helps kind of explain some of the background.
And it is challenging to get an agenda that's up to date because we have to post it so early. And again, what you guys, if you reviewed the video, I deleted off last month's open discussion items and I didn't update it, but that was one item. That was the only item that I had to talk about. So does anyone else have anything for open discussion? In the interest of time, because we have gone over the hour and a half, we've had a 2-hour meeting now. I'm gonna, if the committee will just give me kind of head nods or thumbs up, I'm gonna work with Charmaine, Denise, and May to figure out when the next meeting needs to be, because I think we probably will need to have more updates on what will the plan offerings for medical benefits for 2021 look like. And now that we know that the provider is going to be Florida Blue, we can talk with Denise to see if we want to have them demo wellness options for 2022, which we talked about it last month, but I said we should hold off to find out who the vendor is. So are you guys okay with me emailing out and maybe doing a doodle poll to find the next meeting time? Yep, okay, very good then. Thank you for your patience. I'm sorry that we went half an hour over. We had really important work to do though, and I didn't want the technology to impede our discussion. So I apologize from a time management standpoint, but I do think that we had some really rich discussions for the recommendation to go forward to executive team. So can I get a motion to adjourn?
Motion to adjourn.
Okay, Denise first. I'll second it. And then all in favor? Aye.
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 So it's 4:01, Donna, just for the notes. Thanks for the thumbs up. Thank you everyone so much. I know this was a long meeting. It was great seeing everyone. I really appreciate all the effort and the willingness to speak on camera as well. So thank you.